Thank you everyone for joining us for the inaugural Inside ISAPN pilot episode, where we're going to look at the past, the present, and what's at stake in the future. In this inaugural episode, we will have the pleasure of speaking with ISAPN President Dr. April Odom, and then I will be kind of talking through a couple of issues and asking her questions, getting her opinions on the key elements of the association as we sit today. We're also going to try to reflect on the evolution of the APRN practice role in Illinois, look at some of today's challenges, and then also craft for you a bold vision of the year ahead. We're going to touch on some key legislative priorities that we have in play at the moment, opportunities where members and other APRNs can lead, and then ways that we can get involved as we shape the future of APRN practice in the state of Illinois. So with that, I will turn towards the first topic, and we'll dig into some reflections on APRN progress in Illinois. A couple of key points that April and I wanted to share with you. The first is the fact that Illinois APRNs first gained really significant practice autonomy in the last decade. This was through the passage of the Full Practice Authority FPA legislation, which passed in 2017. Today, we have more than 28,000 APRNs that are licensed in Illinois who serve in a variety of capacities, rural, urban, and specialty settings. And really, that FPA legislation has allowed APRNs to meet primary and behavioral health care needs, both in underserved areas, underrepresented areas, and without unnecessary supervision. It is really ISAPN that has played a critical role in shaping this policy, getting out there, educating lawmakers, and supporting APRNs through this evolution. And with that, I really want to reflect on our president's views and try to understand what she sees as being the moment in our advocacy journey that really she's most proud of.
Thank you, Chris. So yes, as Chris said, I am Dr. April Odom, family nurse practitioner, and I'm the current president of ISAPN. And it has been my pleasure to serve on this board with this team for the last 6 years. So I'm really thrilled to have you guys here as we kick off this podcast series. We want to inform you, empower you, and make sure that all APRNs across Illinois are connected. And so looking about our advocacy journey, there's a lot of things that I always look back on what came before me. But the most important for me for sure has been Full Practice Authority. As Chris stated, that passed in 2017. First licenses started to go out in 2019, and I was so excited to have that license come when it came for me. But just knowing that the APRNs before us did so much work. So even from, having the ability to sign death certificates, having the ability to sign parking placards, 100% Medicaid reimbursement in the state. So all of these things they did before us. And so Full Practice Authority was just definitely another hump in that journey, on that road that we overcame, but we still, of course, have work to do. And so it changed my day-to-day because as a business owner, the things that I was able to do as a full practice APRN and reducing some of those limitations helped me. And so, I am a big advocate and proponent of all APRNs who are eligible in Illinois should have it. There's no doubt it is your professional duty to have Full Practice Authority because those who came before us worked so hard for us. And so it's our duty to continue to carry that on. So now I ask you, Chris, how do you think Full Practice Authority has changed your day-to-day work or the day-to-day work of APRNs in Illinois?
Sure. And certainly that's a great question, especially where I'm both a CRNA and nurse practitioner. I would say as a nurse practitioner, being eligible, it definitely, as you spoke to, opens up practice opportunities. It removes that duplicative supervision where you're having to possibly pay someone who collaborates with you that you don't actually have necessarily a working day-to-day relationship with, more serves in a figurehead type capacity. And so I think that's duplicative, right? It adds cost to care that you're delivering in whatever setting you're in, right? And I think there's pieces of, they're loose, but I think there's pieces that relate to medical malpractice where we have nurse practitioners that have been trained and other advanced practice registered nurses that have been trained to practice the fullest extent of their license and have the educational as well as experiential background to do so safely. So removing that supervising physician that may not necessarily even be in the same specialty or practice with you alongside you day to day, actually, I think has some benefits from a malpractice standpoint and just decreasing the overall cost of care. And I really appreciate you asking that question because being dual boarded, I am passionate about both roles, but for separate reasons. And I would say for the CRNA role, we're going to touch on some of the legislative items that are hot for 2025. But that is something that we really need to see across all the APRN roles. ISAPN was incredibly successful, which is amazing for the NP role, but we really have to see that rolled out across the CRNAs and the certified nurse midwife populations as well.
Yes, exactly. Absolutely. So just thinking about, even though we do have full practice authority here in Illinois, we still have some barriers. We have some stipulations in that full practice license because it doesn't quite align with the AANP's definition. So technically, Illinois is still a full restricted practice state. So we still have barriers, including challenges with insurance reimbursement, privileging, outdated collaborative expectations from employers. So some employers still have a collaborative agreement requirement despite APRNs having full practice authority. And so as the organization, ISAPN, we are continuously fighting for full practice authority and fighting for APRN practice, not even just for APRNs, but RNs and, LPNs and just the nursing workforce in general. And so looking at our key legislative priorities for 2025, I'll talk about a few and then Chris can kind of highlight a few too, but we are in support of House Bill 1706, which is the nurse licensure compact. Just knowing that this is something we want because if nurses, RNs are able to have a compact, then APRNs can have a compact at some point. So we can't have one without the other. And so just having that ability to work across state lines and, not having to have, just kind of having that cohesiveness that we should have, of course, in nursing anyway. Like in Indiana, they have a compact, but here we don't. Most of the states surrounding us have a compact, right, Chris? And then we're just like, the odd man out. So that's one bill that we are in support of this year. Also, House Bill 1807, Senate Bill 1323, which is strengthening nursing education pipelines. That's also coming down the line too. So if you're not involved in your legislation, we highly recommend you talk to your legislators, you look up these bills and you really see what is out here to help for nurses and APRNs. And the last one that I'll touch on is the one that ISAPN is definitely spearheading is Senate Bill 1908 and House Bill 2688, where we are proposing that certified nurse midwives who have full practice authority can be collaborators for certified nurse midwives who don't have full practice authority. And again, we're just trying to increase access to care, especially since Illinois has, 35 maternity care deserts and, there's shortages all over, they're closing birth centers. We want to help increase that access to care for our population in Illinois. And this is one way that we're going to do that is allowing current midwives, certified nurse midwives who have full practice authority to collaborate with certified nurse midwives who don't have full practice authority, which is how it should be because, midwives should be supervising midwives, right? APRN should be supervising APRN. So it just kind of works together. And so what are the bills that we have down the pipeline, Chris?
100%. And I completely agree with the nurse midwifery comments that you made. And I have to just kind of throw back to when I lived in Massachusetts, which is my home state, prior to coming back to Illinois. This was actually something that the state of Massachusetts undertook, whereby instead of just having a physician be the only person that could, be the supervisor or collaborator during that time of reduced or, licensure tied to another person, it could have been someone in the same discipline, right? So it could have been another CRNA, could have been another nurse practitioner, a nurse midwife. And that was actually removed after the COVID pandemic when the data showed that it was kind of duplicative anyways. But I think in order to get to a place where we can increase access to care, certainly allowing like professionals who have full practice authority opens up and removes red tape that really doesn't serve a purpose. It just allows individuals to really increase access to care. And as you said, the maternity care deserts and other HPSA designated areas that are low in terms of care, high need areas, that allows nurse midwives to go into those places and start taking care of patients. So with that, I'll just kind of turn to the anesthesia bills that we're also really tracking and supporting. So we are in support of House Bill 3728, Senate Bill 239. This looks at, again, bringing FPA to CRNAs and putting them on equal footing as other advanced practice registered nurses in the state of Illinois. So we see this as being something that increases access to anesthesia services by allowing CRNA-led care to take place in the state. And I also want to make a comment, because I think oftentimes in the healthcare space and the regulatory space, people think because there is no legal supervision or collaboration agreement, that means that all of a sudden teams will dissolve. We know that that's not going to happen, right? April and I both, in addition to the rest of the APRNs listening to this podcast and this first kind of inaugural ISAPN video, really know that we're always going to work in teams with physicians, with other APRNs, with physician assistants, nurses, nursing assistants.
Pharmacists. Yes.
It's not going to change really in the end. It's more of a formality, I think, than anything else, because cross-disciplinary care is really key to high quality care. The one bill that we are in opposition to, which Senate Bill 1482, that bill was actually looking to introduce a new class of licensee to the state of Illinois, one that we had not seen before. It's actually a profession called anesthesiologist assistants. We don't feel that this actually improves access to care or any equity, solves any issues with equity of care, because by licensure, anesthesiologist assistants would be beholden to a anesthesiologist, only an anesthesiologist, meaning they couldn't work with surgeons, podiatrists, dentists, or any other healthcare professional, gastroenterologist. So we see this as being rather restrictive in nature and not actually improving the overall cost of care. And by having two providers that are capable of delivering anesthesia, providing care for the same patient, we see that as being less cost effective ultimately. And so
yes,
that is something we're in opposition to.
And so some people are probably listening to this saying, well, we talked about one of the legislation that we are in support of is having CRNAs, helping them to get to full practice authority. Well, we just said we have full practice authority, right? But just so you all know, currently, so when the law was passed in 2017, we had to not include CRNAs in that. And that was the only way that the 3 specialties was going to have some headway. And so not that we left our CRNA friends behind, we just, sometimes you have to compromise. And so that was our compromise in 2017, knowing that we were going to come back to this at some point and support our CRNA's colleagues, because we do think that they definitely should have full practice authority, as well as CNSs, CNPs, and CNNs as well. So, that's why currently CRNAs don't have it. And so we hopefully will change that very soon. And that's why CRNAs are in this bill currently.
That's a great point. I appreciate you saying that.
Yes.
It always makes me kind of think of some of the unique nuances with APRNs, right? I think we have a tendency, because we do all kind of practice in unique roles, and probably not as many people understand 2 roles or more than their own role. I think that really can't be understated that having this type of organization, ISAPN, that has all 4 roles represented at a state level, with legislators, with policymakers, with patients, really is an asset. In many other states, April, we just went to that conference in Texas and Austin, the Nurse Practitioner Legislative Conference. And, it was interesting to hear the other states talk about their configurations. And I did make a point of noting that very few actually put all the roles together in one. And I think there's a definite strength that we bring as a group compared to individually.
Yes, absolutely, for sure. So, Chris, what legislative initiatives do you think will have the biggest impact this year on APRN practice?
I really think it's a combination of the bills affecting CRNAs as well as the bills affecting nurse midwifery, because I think both are essential. One is opening the options for access to care models that don't exist. Well, actually, both are in different ways, right? The CRNA bill will allow CRNAs to collaborate outside of traditional arrangements that they may have had in Illinois, again, still in a team-based setting, perioperative care. You're never going to do surgery without a surgeon, so therefore you're not going to do anesthesia without surgery. And then I think the nurse midwifery bill is just incredibly important in this day and age, where as an industrialized nation, the United States leads in maternal mortality for an industrialized nation. I think it is just incumbent upon us to look at what type of high quality models we can deploy to better manage that, right? And so I can't really think in any sense of this problem where having nurse midwives supervise other nurse midwives on their journey to getting full practice authority would be a bad thing, right? Because that's just going to deploy people to areas that have traditionally not been covered by healthcare providers, obstetricians, gynecologists, and family medicine, right? In those rural areas, you don't even necessarily have an obstetrician trained, you have a family medicine practitioner. So those would be my two. What do you think?
And obviously, this is what we do, right? We precept. We help nurses go from novice to expert. This is, this is our model. So it's definitely not something new, that we don't know how to do. So it is only fitting that we collaborate with, supervise each other, help each other grow in our nursing journey, because I always tell people all the time, like, we are advanced practice nurses. We're not physicians. We're not DOs. We're in our own. We're not APPs. A lot of people like that term, but we are in our own lane. Yeah. We're not physicians. We're not, but we have PAs and we have NPs and APRNs. There's a reason why everybody has a role. And so we should be supervising, collaborating with, and, mentoring our own for sure within this profession. And so I'm really looking forward to, talking to my legislators next month at Nurses at the Capitol on these bills, especially the CRNA getting full practice authority and the CNMs being able to collaborate with non-full practice CNMs, because this is the next step in our, in our battles and in our successes, because I do believe that we will be successful this year in those bills for sure.
Yes, I agree. And, I totally appreciate your points before also about the compact, the RN licensure compact. Having practiced in multiple states, although I've never been lucky enough to have a formal residence in a compact state with a multi-state license, I seem to always leave the state before I can get that. But I really see that as being beneficial, not only for the individual practitioner to move to areas that they deem to be a good practice environment or where there's a need, but I also think from a regulatory standpoint, we've seen that happen with physician groups where they have license portability because they're on the same playing field, the same standards. And I totally think that is the right way, the right direction to go. It's also interesting because when you talk about, unfortunately, if there's misadventures in one's licensure journey, right, we're all held to a standard because we have these licenses. But if physicians do run afoul, or if other professionals run afoul when there's a compact in place, that is a consistent mechanism whereby action taken in a state where the problem occurred can be conveyed to other states. And I think that's really, from a patient safety standpoint, the right way to go about this, as opposed to where it is today, which is kind of reliance on nurses, it's reliance on pulling manual reports. And so I think having that consistency and uniformity in terms of across state lines does bring a lot of value. And, you hear people talking about compact being problematic because the state can't do their own thing. I think we've seen time and time again in compact states, they do practice, they do create law packages that are specific to them. They do create enforcements that are specific to them. So I think it's more of a fear tactic in some form to have that reservation, because we just haven't seen that. So
right. I mean, we're not reinventing the wheels. It's not like we're the first state to ask for a compact.
Oh, that's true.
So these people are out here doing it, successfully. So, like, we're not going to be like, oh my God, you guys did this compact and everything went array. No, it's definitely, yes.
100%.
And so, just knowing, it's important to note that, so as an APRN, as individual APRNs, we have to make sure that we are out here talking to our legislators. We should be aware of these bills that our state is, bringing to our legislators that are either support or in opposition of things. And so it's very important to note that all APRNs, and this is why APRN should be members of their professional organization at the state level and at the national level. Definitely at the state level, though, because again, we're doing the work. And as Chris said earlier, some states have multiple, everybody has their own. You have a CNM organization, you have a midwife organization, you have all these different ones. But here at ISAPN, we are in support of all 4 specialties. We're fighting for all 4 specialties. We're protecting these 4 specialties of APRNs. And so having your voice and a part of that and is going to just amplify us in our priorities. And this is how we continue to get the work done. And so if you've never been in advocacy, you've never thought about, what I want to do, it's definitely now is the time to get involved. Quick story, I just recently, 2 years ago, was my first time going to Nurses Day at the Capitol. And I called Marie Lindsay, who was the first president of ISAPN. And I was like, okay, Marie, I'm going to go to Nurses Day at the Capitol, but I need help. I need you. And she was like, absolutely. What do you need? We drove down together. We shared a room together. We walked through the Capitol and she was like, you tell them this, you show them this. She told me they put their pants on one leg at a time, just like we do. And they don't know what you do until you tell them what we do. And she was absolutely right. I went to talk to my legislator and he didn't know what a nurse practitioner did. And, just saying, this is what I do. This is what I want. This is why I want it. And just being able to speak to that, not just for myself, but for all my APRN colleagues. So that's my rant on that. What do you have to say?
I think that's great. I think that's spot on advice. And, it sounds like you had a mentor to take you there and to really walk you through that process. And I have as well, in different venues, had a mentor to help me with that process. And I would echo everything you said. I wouldn't change a single word of what you just said. I would add, it does seem scary at the outset, but the legislators definitely need to be educated. They come from all walks of life. They have diverse experiences that bring them to that seat and that got them elected, right? And then I think that it even goes to a grassroots. Like, I think it's incumbent upon all of us, although it's not something we can do every single day because we have families, hobbies, and other things outside of professional life, hopefully. Some of us, it's pretty much all professional life for a while. But, getting to events with the legislators in the home area that they're from, going to fundraising events, even if you can only donate a small amount, I think showing face, shaking hands, introducing yourself, there is a benefit to repetition there. And, going to the public library when they have a town hall, you're not going to necessarily be able to say something in the town hall. I don't think unless it's germane to your knowledge base. But I've waited around for them and just said, hi, I really appreciate the opportunity. I just wanted to introduce myself, tell you what I did, and some of the things that are important to us. And I think those informal touch points are almost as impactful as going down to lobby day. Now, you should still go to lobby day. And I agree with April. We're going to tell you the date and we want you to come. But having those, if you can't travel and take a day off work, going to those events in your own community and advocating for the roles and our organization has a significant impact.
And then the best thing about it, or the next best thing that I did, is the next year when I went to Nurses Day at Capitol, I took more people with me. So, you can't just, when you have somebody that'll say, I'm going to show you the ropes, then next time you have to bring somebody new along, because we all are just waiting where, we don't know. We feel, I don't know if I can do this, or I don't know what to say. And it's not as hard as you think, but until someone takes you by the hand and takes you with them, it makes it so much easier. So that's definitely the next best thing, is to pay it forward and bring somebody the next time you go, or go, on buddy visits to your legislator. So you don't have to go alone. So there's definitely more power in numbers.
Yes, and getting students involved, right? I think that's the key thing. I was involved the first time as a student, right, in anesthesia school, and it was just like, you should come do this, you should come with us. I really had no idea what I was doing. Sometimes still don't, at least I fake it a little bit, but going as a student, I think, really connects you over the lifespan of one's career, because it demystifies the process, like you said, and it really makes it something that you can just make peace with and say, this is something that's part of my professional identity and something I got to do, right, to advance. So
yeah,
we've probably given a lot of information on advocacy, but it's just something that clearly you can see the passion in both April and I here. Do you want to switch and talk a little bit about the vision for the future with the organization?
Absolutely. So this year, ISAPN, our vision for this year and the future path forward is to focus on 3 key areas. One is member engagement. We've been doing so many things to engage our members, to keep our members informed. When we started having our board meetings this year, we started sending out after board summary, kind of like, this is what happened at the board meeting, so that our members are well informed. And then we offered a one-on Q&A with the president, just kind of, if you had any further questions after you read the synopsis of what happened at the meeting, if you want me to expound on things, just because our members are the most important thing. We know that. And so we want our members to be involved. And I tell people all the time that being in an organization is more than just paying dues. Because if you're not an actively engaged member, you don't feel connected. And so, that's oftentimes when you feel like you're not a part of the organization and you fall off, or, you feel like, oh, it's not important for me now. It's not. But ISAPN should be on your to-do list, and we are keeping our members involved in that. That's one of the aspects we're doing. We also help having more virtual opportunities, making sure that we're doing our APRN to APRN calls, which are free CE sessions for our members as well. And then that gives them some education piece as well. This one, and this month is on, again, federal legislation. So just, all the things that you as an APRN need to know. And we're going to really try to target more specific to the state of Illinois, because again, we are in Illinois. The federal things are important, but this is where you're practicing every day. So we want to make sure we really tell you what you need to know on a day-to-day basis. Networking events for sure. And then students, like you said earlier, we want to get our students involved. I got involved when I was a student, and it was the best thing that ever happened. I didn't realize it then, because you're a student, you're so busy, you don't have time, but you make time. And I guarantee you that the organization will serve you and help you grow in your profession. So member engagement was one. I get off task, as you can see sometimes. Leadership development. So just know that we have mentorship program. There's always speaking opportunities. And I am big on telling APRNs, you have to speak. We need to know what you have to say. We want to hear it. And if you don't tell anybody, nobody's going to know. And then, of course, joining a board or joining a committee. So board appointments will be open this year. So elections are going to be open as every year. And so consider joining, running for a committee. And I can tell you my story about when I first ran later on, but joining a committee, joining a board. And then, of course, policy, as we talked about at length before, is just expanding our presence in Springfield, partnering with the ANA is things that we do all the time, the ANA and other organizations. Again, just we are the experts on APRN practice, but we have to collaborate with other organizations, and we have to let our legislators and the communities know what we do and what we stand for. So those are our 3 focus areas: member engagement, leadership development, and policy influence. And Chris, please tag me if
you said it perfectly. And I would, I think you're going to tell your story, and I want to hear it actually. But I was going to say, I would run for any office that you feel that you are capable of, and probably you're capable of all of them, given your background and your expertise being a leader in healthcare. We don't often feel like leaders as clinicians, but we really are. We've developed that skill set. That's how we navigate patients, families, other multidisciplinary team models, all sorts of regulations, right? So you are a leader. It's sometimes the fact that you have to call it out to the forefront. And, I don't think you ever really fully feel ready until you get out there and you do it. And there is a sense of imposter syndrome, right? I think that we tend to say, oh, I wasn't deserving of this. I'm not capable of this. But then you, as April said, you put one pant leg on the next, and you get out there and do the work. And I think that's really the big, personally for me, that's like the biggest thing at this point, right? Is the fact that, do you have the bandwidth to do this work? And if you do, and if you have the energy and the passion, we can help you with the rest. I'll tell you, I get probably more juice off of mentoring someone else to be better than me in the future than I do actually doing it now. Doing it can be fun at times, but I really like seeing someone kind of go through that process. But what was it? I'm really interested in the story now.
Oh, well, I just want to say real quick, I love that you just said better than me. I tell my kids that all the time, don't be like me, be better than me. And that's exactly what I want is as I'm mentoring somebody, I don't want you to do exactly what I'm doing or be just, I want you to do better and, be more creative. That's why joining the board it's great to have that change. We can't have the same, and this is why we have elections yearly. Our boards change, our roles change every 2 years, except for President-Elect's 3. But we have this change in this role to allow new ideas and new thoughts, people to come and bring fresh ideas. We want to hear what our members have to say. We want those members to join the board, to lead. And so my story was when I first ran for CNP rep, I lost. And I always tell people people can be like, oh man, I just wouldn't run again. And, it was kind of like, okay, I lost it. It wasn't my time. And so I try to really keep that in my head that, what, it just wasn't for me in that moment. I lost the first time. I still was a member. I've been on every committee in the organization probably. So I still was involved, still going to networking events. And then the next year, something happened with the person who had beat me in that position. And I remember Ricky Lore, who was the then president, called me and was like, hey, there's a position open. Are you still interested? And I was like, okay, I guess. and since then, it's just been up from there, just allowing me, like you said, to be that leader that I didn't think, because when I first ran, the Region 7 chair at the time was like, you should run. And I was like, oh no, that is not for me. I'm not ready for that. But since then I've been on, statewide committees and speaking at, conference and speaking to other organizations about, and all of that opened that door for me to realize that I am a leader. I can do this. So definitely. So don't get discouraged. We want you here.
That's right. When you were saying that, actually, it made me think of right after I finished anesthesia school, I had someone say to me, who was actually a faculty member and a preceptor that I admired. They said, you should put in for this new emerging leader fellowship on the board for the certifier, of which I now work for. And I kind of thought, no, I don't think so. I don't think that's me. I don't think I'm intelligent enough. Anyways, I put together the application in rapid succession, put it in, didn't get even offered an interview, of which they usually offer in interviews. I did some committee work with the organization, really started to understand the mission, vision, values, right, which you get from going to meetings, getting immersed in it, talking to people that are in leadership positions and then sharing freely. The next year she said, are you going to apply again? And I said, no, I'm kind of like a little gun shy given the fact that they didn't even interview me. And she said, I think you really should. They did offer an interview, and they did offer the position. And later I remember board members saying, when you came into that interview, you really understood exactly what it was that we were looking for, what we were doing as an organization. So I think, to your point, sometimes when you hit that wall, one, it's a matter of like resilience, dusting yourself off, getting back up, and having that ability to kind of like go back again. And I think the other thing is sometimes many of us believe this, when a door closes, another one opens, right? And so I think having that time to then be involved in other areas of the profession really did refine my thought process about why I wanted to do it.
Yeah, exactly. Yep. I always tell people you're exactly where you're supposed to be. Don't worry about it. Like it's gonna work out, but you are where you're supposed to be. So it's not a race. It's not a marathon for sure. So you just, I mean, it's not a race. It's a marathon. You just keep going and keep going, right?
Yes, for sure.
So Chris, tell me, what's one initiative that you're particularly excited for this year, or to see it launch or expand?
Probably membership engagement, right? Like, I think that we've seen in multiple membership associations, ISAPN is definitely not unique in this regard. I think we've seen a couple of trends, right? Post-pandemic, right? We see individuals not necessarily understanding the value proposition that this has for them individually, or then in their career, their professional life. And I think associations had to do better on that. And we're doing better on that. We're focused on what CE offerings are in demand, what can we do for people, what legislative actions can we take and really be persuasive to move legislation. But we can't do that alone. We need members to support us, and we need people to get engaged. And I agree. I think we've said it a couple of times here, but you need like the rope tow effect, like at the ski resort, right? You grab on, there's someone in front of you, the next person grabs on, then you go down the bunny hill. But I think having that membership engagement is really key to advancing everything that we're trying to do here. I think the other part, and you know, I kind of straddle a generational line. I won't tell you which one, but you know, I think some generations really just don't see the value in having a membership association. I think over time that will change, but right now they don't see it. They think that they can, certain generations think that they can engage on other platforms, and it gives you the same thing that this would give you. It doesn't. It gives you a portion of it, I think, surely, but I think getting face-to-face with individuals, April and I are good people to get face-to-face with. We're fun to talk to, and we're fun to have a night out with if you are so inclined. But you know, having that time, that informal time, and having those conversations really do expand opportunities in the future. Because when you're talking to people at those meetings, even if it seems like it's a nothing conversation, right? Later down the road, they will reach out to you and say, "Hey, I was thinking about you for this opportunity," and that type of networking is so invaluable. Right.
So
It's not what we say to people, it's how we make them feel. And so that's your opportunity to really get into that space, do the networking, and make people feel a certain way, because then they look back and they think, that's a person that I really need to get engaged with. So
yeah, I'm big
probably
on
talk too much about that.
no, yeah, I'm sure I'm big on that. Like, you don't know who's in what room and why you need to be in that room. There's always a reason that you're in the room you're supposed to be in, and you know those opportunities open up. So I remember as a student, I would go out to dinner meetings by myself. I didn't know anybody. But you know, no matter where I went, no matter who I met in ISAPN, it was always welcoming. And that was kind of, again, why I stayed, and why, you know, why we're committed to like making sure our members feel that when they step into any ISAPN event.
Yeah, and you know, for someone that lived in the state when they first graduated with their first APRN license, and then left, went home to Massachusetts, and then came back, you know, for other employment, I can say that this was not a thought in my mind whether I will join again. I just knew that this was something that I needed to do, and this was something that was going to connect me with the various points in the state across, you know, from the bottom to the top of the state, right? All the legislative actions are happening in the bottom, and a lot of the population's in the top of the state. So we really need an organization that connects all of us across all four licenses to the things that matter, I think.
Oh, I like how you said that. Yes. Yes.
Well, you know, I think we've touched on a number of things, the legislative, the policy, what initiatives. I think a couple of other things that we just wanted to convey to individuals listening to this is really we individually feel that APRNs are really key players in addressing access issues. There's definitely statistics that show as high as 92% of Illinois counties being health professional shortage areas. Now that could be for a multitude of licenses, but I think that speaks to a reality that we need to expand care, whether it's dental care, maternity care, anesthesia care, medical care. I think it spans the gamut. The other thing is really behavioral health crises. I think we've all seen, probably April, you more than anyone being in a primary care practice and doing home health, behavioral health crises, right? After the pandemic, what has that world looked like for you?
Oh man,
Different?
just yeah, so different. And even, like I always say before, I remember pre-pandemic, patient who was bedbound needed to get superior to go to the hospital appointment. They don't do that anymore. So literally, I have people in the home who can't get out and they need a cardiologist, or they like, and they visit. So it's like, okay, well, let's see what we're gonna do, because like literally they can't get out. So that, and behavioral health services, like when I started doing house calls in the beginning of the pandemic, a lot of people didn't want to go into people's houses because they didn't know, like, so a lot of organizations, they just stopped, and these patients were just left, and they were just going to either use the ER or forego care altogether. And I was like, this can't happen. Like it's so, yeah. So that, all of that has definitely changed. And so I was really glad with the, expansion of the telehealth services and things like that to actually bring more care to these patients.
I think that's so contemporary of a topic, right? And like we see these companies like Dispatch Health, and there are other, that's just one that comes to mind, but there, and I have no affiliation, let me just say that too. But you see those companies going into the home health space, right, trying to bridge the line between primary care and urgent care.
Mm-hmm.
And those urgent care clinics that have opened in Walgreens, CVS, and other commercial spaces were a way to, it's interesting, like in 2009 when I was getting my first master's degree in nursing, I wrote a lot of papers on like ED overcrowding because I had worked as a paramedic, and it was kind of like I knew the topic. Those clinics were really meant to decrease utilization of high cost, low it's not low quality, but high cost care, right? Certainly for like things that could be more efficiently delivered. And so you see all these companies now in the home health space and trying to do urgent care. And I think, to your point, people are just so used to being at home, and telehealth is really the next frontier. And it's good that the federal government and states have said this is a durable solution, right? It's not just a solution for a pandemic. We've now seen this materialize.
Mm-hmm.
Um,
Absolutely.
I think the other one we've talked about is maternal health gaps, right? And I said, I every time I see that we're like from an industrialized nation that we are leading in mortality, and I do practice OB anesthesia at the hospital that I work as a CRNA, and so I'm somewhat familiar with that population. But you look at the C-section rates in the country and other variables, right? I think, even though I don't have a uterus, right, that we need to make sure that women have the option to labor when it's safe and when it's appropriate, home births when it's appropriate, things that are out of the hospital, right? And I think certified nurse midwives certainly do offer and afford some of those things that are maybe a little non-traditional in the medical model, but definitely efficacious and practiced across the globe. So
Absolutely. I tell people all the time, I'm very proud that, and when I had my first son, I didn't even know really what a midwife was. I was assigned to a midwife, and I was like, okay. And it was the best experience ever. Like from everything, my whole prenatal care, like she was just different than what I had seen before in healthcare. And, just being able to talk to her about things, and the education piece that I received. And then during my birth, the way that I was able to deliver, I didn't have an epidural or anything. So my delivery, though, was much easier because we tried different positions and different things. And I mean, I delivered in a hospital, but so I went out to find for my second birth. I was like, I need a midwife. I'm not having anything else. Now, my second birth's always different. So my second birth wasn't easy as my first one. But again, I just had that option. I was adamant about, I need a midwife. I definitely recommend them to anybody. So I love our midwives for sure. Just like you said, that just how they take on things and how they're increasing access. And, they know when it's safe to have a home birth, like they know this is what they do.
Yeah. And especially if they're following you over the entire course of the pregnancy and the postpartum period, building that relationship. Again, in no way do I think any of the the comments that we say in this podcast or any other podcast speak to the fact that we don't think that other disciplines can do the same thing. But I just think that painting with a broad brush, they do a great job of being holistic, using the scientific underpinnings of what's safe, to your point, for that whole period of pregnancy, right? Which is complex, right? The physiology, the concerns, the needs. And so allaying those concerns and providing for safe childbirth is really a key driver to improving maternal health in the U.S.
Absolutely. And everyone has a role. Everyone has a role. This is why we have these fields. Like, everyone can be in their role and be experts in their role. And that's great. Like you said, we're not saying, oh, this profession is not as good as this profession, but I love being a nurse. I love being a nurse. I love nurses, but I have some really close physician colleagues too that I love. And I had my first preceptor was a physician, and she was amazing. I was like, oh my gosh. So, but again, it's just, we have, we all have a role and a place and a space, and we all have one goal. I say this all the time. We all, no matter what specialty you are, no matter whether you're a physician, a physician associate, APRN, we have one goal, and that's to take care of the people. That should be our goal. So we need to just get that done, make sure our people are safe, make sure our patients are safe, our populations are safe, and our communities are thriving. That's our goal.
Yes. Yep. Patient first. And, the times that I've gotten a less than professional exchange with another individual, it's always what I say to kind of diffuse the situation is the patient's needs come first, right? And that's a Mayo Clinic saying. I didn't coin that, but I do think it's a great North Star for us getting back on track and focusing on the key elements, right? Because we're all people. We come to work with our own baggage. We have our own things. I think ISAPN, by being a member, really, you're embracing leadership, innovation, and entrepreneurship, getting the opportunity to network with April, who is a nurse practitioner entrepreneur that lectures on those topics, that knows them day in and day out, and can eat, sleep, and breathe them. Really, that's something that you get access to by being a member of ISAPN. And then we really feel, I think, strongly as an organization that APRNs can help lead not only practice in, but lead system redesign, right? And so we've talked about primary care, telehealth, and community health models. And so those topics are definitely things that I see as being legislative actions in the future, right? As we start moving forward, once we get full practice authority and some of the licensure regulatory places cleared up, it's now, where else can we go to broaden care? So, do you want to talk about getting involved with ISAPN?
Yes. So, one, I'm going to say, get involved. We need you for sure. It is your professional duty to be a member of your state organization. And again, like I said, don't just be a member and pay, but we will need you to be on a committee or come to an event even. You don't have to be on a committee. Come to an event, introduce yourself to me or Chris when you see us, because we want to know you, we want to help you. So getting involved, again, is your duty. The more members we have, the stronger movement we can make. So just consider that we do have some events that are coming up. So April the 9th, 2025, we have Nurses Day at the Capitol in Springfield. And again, if you haven't never been, hit me up, because I will gladly take you with me and my crew. I have a crew going already, because we're going to go and talk to legislators, because we have some important work to do this year for sure. Learn about bills. So in the beginning part of the morning, we're going to sit and learn about the bills that we want to talk about. You'll get talking points, so you don't have to remember these things off the top of your head. And you get contact hours too. Plus, we get lunch, we get to network. Again, it's just being visible for nurses. We shared this event with ANA Illinois, but I know I got a word that there's going to be almost just as many as APRNs there as the ANA Association. So I'm really excited about that, because sometimes we don't have a big representation of APRNs. So I really am happy that we're going to have more APRNs this year at that event. And then we're going to have pharmacology update on April the 25th, which is going to be in Champaign. And this is our annual pharmacology update. And it's 7 continuing contact hours, all pharmacology. And we're going to have topics like testosterone, schizophrenia care, ADHD, cardiac pharmacology, and even talking about neuromodulators. So tox, Botox, Xeomin, neuromodulators. So a variety of topics. So we have a little bit for everyone. And so we want you guys, I hope to see you guys at an event. I'm sure, Chris, we want to see them, right?
100%.
We need you to be there.
Isn't there going to be also the ability, like if individuals can't show up that weekend that we're having in April, isn't there the ability to log on afterwards, listen to some of the recordings?
For the pharmacology update?
Yes.
I don't know if it's going to be recorded this time around.
Okay.
So, but usually it is. I'd have to double check that, but usually it's recorded and then you can get the access later. Maybe I'm getting that confused with Midwest Conference. No, we're going to record that.
That's okay. We'll clarify that when we push it out. That was actually my fault, but I was going to say also, April, like, you know, some of these topics, like depending on your specialty, you may say, well, I don't need to know that, but I'll be honest. I think regardless of your specialty, primary care, specialty care, nurse anesthetist, nurse midwife, I think that the topics, like you always get into these things, and I think exposing yourself to them from an expert standpoint always going to be of value. So we do want to see you there.
Absolutely. And then we also want you to, you know, consider joining a committee, attending an event. Some of the committees are, you know, not a lot of work. So they're, you know, a good chance to just kind of get your feet in and see what's going on within the organization. Attend an event, definitely talk to your legislators. And if you're already a member and you're listening to this, first I want to say thank you for being a member. I appreciate you. Chris appreciates you. I know. But definitely invite a colleague. So I know a lot of times people are like, oh, this person's not a member. Tell them why they need to be a member. Tell them that, you know, this is a great organization, because it truly is. The work that's being done. And sometimes I don't even say that the work that they're doing for us, for me, like, is so invaluable. And, you know, like, we all are doing the work for each other. And so we definitely need all the members. We need all of the APRNs in Illinois to be a member. So maybe what would you say, Chris, is a great place for somebody that's hasn't been hearing this podcast and want to know, okay, how do I get into ISAPN? How do I engage?
Well, you can do like I did when I moved back. You can sign up on the website, right? We have multiple different practice categories for individuals, whether you're a student, practicing professional, or a retiree. I think there's also a military right now that we've endorsed on the website, but I think that's really the first step, right? That's going to get you access to the members only portal, also the messages that are members only, keep you abreast of the legislative updates. I didn't rehearse this, but I do sound convincing here. Legislative updates, the CE offerings, and then also gives you contact information. And I do echo what April said before. You can reach out to us. I can honestly tell you, in the past, when I've joined organizations and associations, I've always kind of wondered, like, if I could contact leadership, felt like they were so far away. You kind of look at them from afar when you're at a meeting. The reality is that both of us are very easygoing people. We want to talk to you. We want to hear what's going on. We want to learn from you. You know, it's a two-way street. It's not a one-way street. So I think those are really the key ones I would give.
Yes, absolutely. Perfect. So, so we hope to see you around. When you do, just come up to us. I swear we won't bite, and just say, hey, we heard you on that podcast, or I saw you on the website and I want to know more, or what can I do? But I'm going to tell you a warning, though. If you tell me you want to be involved, I'm going to make sure that you're involved. So be ready.
That's good. That's good. We want to engage people, especially early and often. You know, I just want to say thank you to you, April, for coming up with the idea to even do this podcast. I'm really looking forward to see where this goes. I think that this is just an incredible opportunity. Maybe some of the people will listen to us on 2 times speed, like I do with some podcasts, and there's there'll be no problem if you do that, right? We want you to get it in however you get it in. We also want to know if it's meaningful to you, right? We try to strike a meaningful conversation. We do have a plan for topics to follow up with over the next few months, but that plan can change, right? We want to know what you want us to be talking about, sharing with you, and bringing in other individuals, guests We really want this to be something that I think is member driven, and I can't thank you enough for coming up with the idea. I would never would have done this on my own, April, without you motivating me to.
Well, that's me. I'm always trying something different. But again, for the organization, like I'm definitely, let's see what the members want, because it's hard for us to know exactly what we can't give every single person something, what they need, but we can try to give everyone a little bit of something. And so we just need to meet our members where they are. So if you're busy, you're working, you can't read your emails, because we get inundated with emails. I know being able to listen to this podcast and know what's going on inside ISAPN is why we're here. We're here to support you, uplift you, advocate for every APRN in Illinois. No matter if you are a new APRN or student APRN, or you're retired APRN, we advocate for us all. And so we really appreciate you. We love the APRNs in the state, and we are looking forward to what this year has to come.
Very exciting. And the other thing I'll put in a plug for, because I think the algorithms do us a benefit here, is if you can share or repost this, we would be incredibly appreciative, and thank you again.
Yes, thank you guys. Thanks, Chris.
Thanks, April. Talk to you later.
All right.